Because childhood adversity has such a tremendous impact long-term on our physical health, our mental health, our behavior, that addressing these issues may have the greatest public health impact since development of vaccines.
I feel that right now, America does not pay the kind of attention to families and to youth, and they don't support them the way they should. And so consequently, our children are suffering from and dealing with a lot of challenges. And so it's important to listen and to try and work together to change that.
We as professionals who work with youth and families and community need to start by looking at the core health of every person we serve.
We want to be able to help youth stay calm. We want to build trusting relationships so that we can help those youth to have a successful life.
Young African American men are in a state of crisis here in Minnesota and across this nation. They're overrepresented amongst those in the criminal justice system. They're overrepresented amongst those who are unemployed. As part of the human family, they deserve an opportunity to be successful.
People who work with youth must avoid confrontation and blame at all costs, because you never know what type of trauma that child may have experienced.
What happens in your encounters with teenagers is a big deal and can impact the rest of their lives, so take it seriously.
The Center for Disease Control's Adversive Childhood Experience studies have shown that the more adverse childhood experiences a young person has, the more profoundly it affects their life, including their longevity. We need to think about prevention. People with mental health disorders are shown to have shorter lifespans and to have more incidences of physical illness as well as the mental illness. So we need to have help for young people so that they don't have a history and a lifetime of suffering from mental health problems.
I think that what this study tells us is that so much of what we see later on in life really has its origins in adversity early in life, and that many of the people that we come into contact with, we can't blame them for what happened to them. That life gave them what they got without asking for it. And our understanding of this, our compassion as a result of this, our change in our response to people is what we need to take away from this.
What we as professionals and work with families and communities need to do is look at our intervention and prevention methods based on the research we know and the impact of trauma, how it affects families' behaviors within communities, how it impacts a child's ability to develop and reach their full potential. And without basing our intervention and prevention methods on what we know and being more restorative in nature versus punitive, we will never make headway in eliminating future traumatic experience and violence.
And when a person is scared, and if they have been victims of trauma, how will they respond? They're paralyzed, they could be aggressive, they could want to run. So you need to gain that trust, be calm, be kind, speak a couple of words in Spanish, say, mijo, ¿cómo estás? ¿Qué pasó? Very calm, and explain the process.
A number of the young men who participate in Brotherhood are coming to the door with a great deal of trauma. For example, many of the young men have been pushed out of their local school, whether a junior high school or a high school. Sometimes they're placed in an alternative learning center, or they're forced onto a special education track. Through those tracks, they ultimately wind up typically in the juvenile or adult criminal justice system. And experiences within the juvenile or adult criminal justice system lead to a great deal of emotional trauma and stress that these young men experience.
When I was breaking down at my school, I felt really hopeless. I felt worthless. I felt like why was I even trying to keep moving on, keep going forward? I said I'd rather be dead, or I was saying I'd rather die. I feel like I should die, or I'd rather, you know, go do the things I used to do. You know, I wanted to find a way out because it was so hard, you know, coming from a facility, then coming home, and then trying to, you know, get into the mood of things. You know, I still felt like I was still locked up.
Be assertive but less formal. You know, let people know that you're a person like they are. Let them understand that. And I guess that it might help to understand that our kids don't believe in, and nor do we believe in, a hierarchy so much, one person having more authority than another, but we see each other as members of the same community. And so the policemen, for example, will work more effectively with our kids when they communicate that they are members of this community to the students through their actions and their words.
We are immigrants, we are new to this country, we have many challenges, we have many difficulties. So we don't know. There is many things that we don't know. So we need to have a good connection with the American community who've been here for a long time and get their experience.
The key to building trust is to first build a positive relationship with the children. Once you've established that relationship, then they'll feel free to come and confide in you issues that they're dealing with that in the home.
Take an extra 5 minutes to just listen to someone, to let them vent, which sometimes I'll do, let them yell. It doesn't hurt, you know? It doesn't hurt me if they yell at me. Some of these people are angry. They have a reason to be angry. They're in a crisis. If you just take the time to show them a little respect, let them vent, a lot of times the outcome can be different than grabbing hands-on, you know, and you're off to jail or you're going to the hospital.
Be a strong foundation for that person. Be that rock. Show that person much love for he or she, what they're going through. You know, you want to see them do better, even if they're doing bad or going through hard times. You know, love is the ultimate key, and by showing love, we can change the world.